Coming up today, the dense breast double whammy. Density raises cancer risks and makes cancer harder to spot. The questions all women should be asking when they get their mammogram. Good morning. I'm Jessica Lovell. Welcome to the Morning Medical Update. Nearly half of all women over 40 who get a mammogram have dense breasts. You cannot feel the density, but you can see it on a mammogram. And this video here will show you the challenge dense breasts create. Cancer, that white spot on the left, it's easy to see on that left breast because that's mostly fatty tissue, but dense tissue, like on the right, also shows up in white, and it can hide the cancer. Even doctors can have trouble spotting it, which is exactly why women need to know their breast density. And today we want to empower women and make sure that they have the knowledge that could end up saving their life. That includes getting tests beyond a mammogram. We're going to talk about those today. Here with me in the studio is Dr. Onalisa D Winblad, Division Director of Breast Imaging at the University of Kansas Cancer Center. She reads breast images, only breast images, all day long, and she has admitted that dense breasts makes your job harder. That's a big challenge.
Absolutely.
So we'll find out exactly why. We're also joined by Katie Mullen, who learned that she had dense breasts after she had her first mammogram. Katie, how are you?
I'm good, thank you.
Good. Thanks for being here at the table and just talking all things. We've been talking about breast cancer and breast health all through October. So this is just a topic that always comes up. We seem to weave it into every conversation, dense breasts. But earlier this year, Dr. Winblad, back in March, the FDA updated the standards. We've talked about this. Starting in September of 2024, mammogram reports must include a breast density assessment. Now, we here at the Health System at the Cancer Center, we've already been doing that. That's been our standard. But Dr. Winblad, what's your reaction to that rule change? What does this mean when we implement something like that across the board for all women?
Well, this final rule is a win for American women. Expert committees have actually been advising the FDA to require breast density notification for over 10 years. So because we have not had a national standard for density notification, it's been quite variable. Breast density notification may vary depending upon the state a patient lives in or where the patient gets a mammogram. So many patients have not been getting crucial information that could save their life.
So, Katie, you got your first mammogram at 40. Very proud of you. Being a good patient, good woman, we love that, and setting the example for women. What do you remember when you got that report? And had you heard of breast density before?
I hadn't, and I remember it being like a red flag situation and being like, oh gosh, what's wrong now? What do I have to do now? And it did take a bit to understand what that really meant and why I needed extra testing. And even, like today, explaining to my parents why I was coming down here, they're like, wait, what did you have? Why do you have to go in for extra testing? And it's a complicated thing.
Well, you must have been like me, because I really hadn't heard about breast density until the last few years that, doing this program and talking to people like Dr. Winblad. So you must have been like me, maybe your friends who are in your age group just getting their first mammogram. That might have been a new topic for them as well, right?
Oh, for sure. When I've told people, that I had to do, just on the way to get it done or whatever, they're like, what do you have? And so because it is, I don't think any of my friends had even heard of it either.
Like,
so.
What does it mean? You know? So what did you do with the information? You find out that you have it, so did you?
Well, they called me and they said, okay, they explained it to me and they did a nice job of explaining it. And they just said, it just means you have to come in for extra testing. And so.
But that must have concerned you a little bit.
Yes,
right?
for sure.
Yeah,
for
anytime
sure.
you say, we need you to come back for extra testing, but then they clarified.
Right, absolutely. And now I have to do it twice a year, so that's kind of, a bummer too. But, they just kind of explained, not only do you have to do a mammogram like everyone else, but you also have to come in and do the extra testing every year. And you're just going to have to do it forever. And that's just the way it's going to have to be. And so now I know April and October are my
you have one
times
date.
that I get to go to the hospital again.
That's what I was going to say. You have one date on the calendar. Now you have two. Dr. Winblad, what should women know about what to do when they're told they have a dense breast? I mean, gosh, it's hard to get some women to even get into their mammogram once, and now you're telling women you might have to come twice.
Absolutely. Well, if a patient sees that they have dense breast tissue, you'll see that on your result letter or your report. I recommend a patient first talk to their healthcare provider or ask the mammogram facility what their options are. The recommendations for additional testing may actually vary depending upon local availability and what's available in your area. At KU, we offer several different options for our patients with dense breast tissue to meet the needs of hopefully a large number of our patients.
So density is broken into 4 categories, is that right?
Absolutely.
So help us understand the categories and what makes a dense breast dense.
So breasts are essentially made up of 2 different types of tissue, fatty tissue and fibroglandular tissue. Fatty tissue appears gray on a mammogram, and you can see nicely here in the picture that's being shown on the left-hand side, that's a patient that has fatty breast tissue. Fibroglandular tissue appears white on a mammogram. So over on the far hand right side, you see a patient with extremely dense breast tissue. It's all white. And as you said earlier, cancers can be white. So cancers can be hidden within extremely dense breast tissue. So we divide breast density into 4 categories. They're shown here, and they're divided by the overall amount or percent of dense tissue within the patient's breast. So we have fatty, scattered, heterogeneously dense, and extremely dense. And those far to right-hand categories, the heterogeneously dense and extremely dense, are our dense categories. And for those patients, we offer additional screening exams.
So Katie, do you remember which category you fell in on those 2 on the right?
I think I was extremely dense.
Extremely dense. This has always been my question, and I'm sure others want to know this too, because off the top we talked about dense breast means higher risk of cancer. Is the tissue itself making it a higher risk of cancer, or is it the fact that it's harder to find and you miss it? What's making you more at high risk?
It's both. Like you said, it's a double whammy. It's harder to find, but patients also have a higher risk of cancer. So breast cancer arises from those fibroglandular elements in the breast. And as we showed in that picture, patients with dense breast tissue have more of those white fibroglandular elements. So their breasts have more opportunities to develop cancer. So it's both.
So tell us, we have some images, 4 images of a mammogram. So kind of show us what we're looking at here.
So here you can see 4 patient images. These are 4 different patients. The patient on the left-hand side has fatty breast tissue. It's mostly gray. And you can see a tiny little mass in her breast. That's a cancer, and it's pretty easy to see for everyone. You know, in a fatty breast tissue, it's just far easier. Those 3 other patients on the right-hand side, they all have breast cancer, and they all have dense breast tissue. And I can't even see the breast cancer in those patients. And in a little bit, we'll actually show you where their cancers are.
Well, so, and hold that up if we can, because when you look at that, you recognize we need more testing. So somebody comes in, you're looking at this image, those other 3 on the right-hand side, you're going to go, we need to move forward to an ultrasound or an MRI. All right, so let's look at some of those same breasts, but different imaging techniques. We mentioned MRI. Let's look at that.
So on the left-hand side, that is one of those patients with dense breast tissue. And if you look at the MRI picture to the right-hand side, there's a very obvious white enhancing mass. That's a cancer in the patient's right breast. That is not difficult to see on an MRI. This is a great example showing how sensitive MRI is and how it looks at breast in a very different way. And cancer in this patient was very easy to spot on the MRI exam.
So when should someone get one?
So we recommend all patients who are high risk, so 20% or greater lifetime risk of cancer, have an annual screening MRI starting at age 25 to 30. And we recommend all women have a risk assessment by their healthcare provider by age 25 to determine risk. Patients with dense breast tissue should also consider breast MRI screening, especially if you have additional risk factors.
So are you getting MRIs, Katie?
I am, yes.
So you're doing this every 6 months?
No, it's every year. They
Once a year.
alternate with the MRI and the mammogram. So I'm getting screening every 6 months, but it alternates which type.
What are those tests like? To kind of walk us through what that's like. We hear about what mammograms are like. A similar experience?
Well, the October's my mammogram one, so I actually go tomorrow, and so that's just a regular mammogram, just like every other woman over 40 gets. But then the one in April is my abbreviated MRI, so I have to go in and get an IV and get the contrast and all that, and then I just go into the MRI machine, and it's not a long thing, but it's kind of a bummer to have to get the IV.
So it's a bummer, but you got to do it.
Yep.
So I want to look at the ultrasound images. Dr. Winblad, when would someone need one, and what are we seeing here?
So here on the left is another one of our patients with dense breast tissue, and we can't see anything on the mammogram, but over on the ultrasound image from an ABUS or automated breast ultrasound exam, we can very easily see an irregular dark mass, and that's a cancer. So breast ultrasound, we offer several different types, including automated breast ultrasound, is another type of screening exam. When patients have dense breast tissue, ultrasound is one option, and it's typically for patients who prefer not to have an IV or contrast administered. Breast ultrasound does not find as many cancers as MRI or contrast-enhanced mammography, but it's still a really good test for patients who desire additional screening for dense breast tissue.
Let's talk about the contrast-enhanced mammography. I think we have one last image. Tell us what we're seeing and when are those necessary?
So this is our last patient with cancer. We can see on the right-hand side, it's a mammogram image, so it looks very similar to the left-hand standard mammogram image, but this time we're looking at contrast enhancement. So we see that mass very easily on the right-hand image in this patient with dense breast tissue, whereas we cannot see it on the left. So contrast enhanced mammography is one of our newest methods for breast cancer detection. It's similar to MRI in that it requires an IV and contrast administration, but the type of contrast we use is different, and it uses a mammogram machine instead of an MRI machine. So the mammogram technology is different, but to a patient, it's going to feel no different than having their regular mammogram, except for the fact that they will have an IV and contrast administered. And we recommend CEM, or contrast enhanced mammography, for patients who are not able to undergo breast MRI.
So are these screenings, these further screenings, are they covered by insurance?
So mammogram screenings are covered at no cost by insurance. That's the law. In most states, out-of-pocket costs such as copays and deductibles are still required for supplemental screening exams such as MRI, ultrasound, or contrast-enhanced mammography. Now that we have national breast density reporting, we have an even greater need for federal laws that mandate coverage of these exams at no cost. In 2022, U.S. Congress members did introduce the Find It Early Act and are hoping to push forward bills that will cover these additional exams at no cost for patients. But right now, there's still cost sharing associated with supplemental exams.
So on top of imaging, patients can sometimes be called back for a biopsy. Katie, you were called back. Why is that?
They found something on there that was suspicious, and I don't remember the details of exactly what, but they said, we found something that looks bad enough that we think you need a biopsy.
What were you thinking in this moment?
Of course, I was like, oh no, but they did reassure me. They said, 80% of the time these come back fine, so hopefully that'll be the case, but we have to get in there and double check it, and so luckily it was fine.
Okay, suspicious, that's always a scary word, but you're saying not always worst case scenario, right? I want to ask you about, is there ways to prevent unnecessary biopsies?
So first and foremost, I recommend patients get your breast cancer screening exams at a facility with breast radiologists who are specialized experts and can provide the most accurate results. But as you said, it's really important to note that most breast biopsies are going to give benign, non-cancerous results. Breast cancer is extremely common, and we are going to perform a lot of biopsies so that we don't miss cancer. In fact, we biopsy any finding that has a greater than 2% chance of cancer. So most of our biopsies will have benign results.
Is it possible, though, for you to live in an area or part of a state anywhere in the country that does not have these high-end extra screenings available? You find out you have dense breasts, but is everywhere you go going to have this type of opportunity to do some further screening? And if the answer is no, what questions do they ask their doctors about where to go?
That's a great question, and the answer is no. Not all facilities are going to offer supplemental screening tests. At KU, we offer a wide range, and that's pretty rare. Most breast imaging facilities don't offer multiple different types of screening tests for dense breast tissue to meet the needs of their patients or to provide good access. So it's really important you find out what's available locally. Right now, I think there's still quite a variability in what is offered. Part of that is because there hasn't been a national breast density reporting standard. Another part of that is because there's not national federal laws requiring insurance coverage to pay for these exams at no cost. So there's been a variable implementation of different kinds of supplemental screening studies within regions, within states, and nationally.
I'm so glad you mentioned it, though, Katie, off the top, that you now have to go twice. Nobody wants to do it once, and you're now having to do it twice.
Right.
But what concerns me is that women who think they're doing the right thing, okay, I found out I have dense breasts, I get my mammogram once a year, I'm hoping when they hear this, they know, oh, wait, if I'm only doing it once a year and I have dense breasts, I should be getting it twice a year. And then to know the questions to ask and to know to come seek you out or someone very similar to you out.
Absolutely.
So good to know. That's very, very good to know. If you have questions, be sure to get those in on YouTube or Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. Let's get our COVID count. Dr. Dana Hawkinson is joining us on this Monday. Hi, how are you?
Good. Happy Monday.
Yeah.
It was such nice weather over the weekend, too. Hopefully everybody got out. And good news here, too, at the health system. Only 15 active patients with COVID-19, so that is good, down from 20 last week. Hopefully we'll continue to see these numbers plateau or even go lower, although we are obviously getting further into respiratory viral season. Still not a lot of numbers of active RSV and influenza hospitalized, but again, the COVID-19 active numbers are 15 at this point.
All right, Hawk, a question for you. The drug maker Sanofi is admitting that supply is simply not keeping up with the demand for their new RSV treatment. Their monoclonal antibody shot promises to protect high-risk infants from the virus, but a lot of pediatricians are saying that it has been hard to find this shot. We know RSV season is right upon us. It's starting now, right? And what could this mean?
Yeah, no, we are definitely into it. And I think that's just the norm anymore with supply, whether that's for normal non-medical goods, but especially medical goods. We've seen short supplies of influenza vaccine around the country, as well as RSV vaccine. Now, this is actually it's not a vaccine, it's more of a preventive therapeutic. It's a monoclonal antibody that is given to infants under 6 months of age or under a year when they are born, preceding respiratory viral season or during respiratory viral season. So this serves as a protective measure for those newborn babies so that if they do get RSV infection, they don't suffer those severe consequences of having to go to the hospital. And unfortunately, yeah, there is a shortage around. I know we at the health system don't have it just yet, but this is something we've seen not just with this medicine, but other therapeutics as well. Hopefully that will subside, but also we know there is that vaccine for pregnant mothers to get, which they will get the vaccine. They will develop an antibody and immune response, and then those antibodies will be transferred to baby through the placenta prior to the baby being born. That will provide protection as well. So that is very important to understand. We know that there is a decrease in the amount of maternal vaccination rates as well for many different things. So it is important to continue to be able to find, first of all, maternal health care. We know that is an epidemic around the country as well. And then talk with your providers and get those vaccines to help prevent both yourself and your baby as well.
All right, Hawk, thanks so much. Let's get to some questions from our viewers this morning. A question is, why not just skip straight to the ultrasound or MRI if I have dense breasts?
Mammograms are still very important. We still recommend annual screening mammograms. Mammogram screening has proven to reduce mortality from breast cancer, and we still see many cancers on mammogram, sometimes only on mammogram. So mammogram still remains crucial for breast cancer screening.
Another question, can breast density change over time? So let's say I don't have it today, but could I get it a few years from now?
Absolutely. So breast density commonly decreases as we get older, but breast density can also increase with weight loss, with pregnancy or breastfeeding, with hormone replacement therapy. So do not be alarmed if your breast density changes over time.
Do implants make it harder to spot cancer?
We still recommend patients with implants undergo annual breast cancer screening with mammogram, and we can still find cancers in patients with implants. We do have to perform 4 additional views just to ensure that we are able to visualize all the tissue in patients that have implants, but we absolutely can find cancer, and it remains very important for those patients.
What about the size of your breast, weight, obesity? Does that make it harder to detect breast cancer?
So obesity is a cancer risk factor, and it's a breast cancer risk factor, but increased weight or decreased weight does not typically make cancer more difficult to find unless it results in a breast density change.
All right, question from, well, actually just a comment from Ruth Ellen. She's a faithful viewer of ours, so I want to ask you this. She says a friend of mine who lived in the far west part of Kansas actually had to go across state line into Colorado to get her mammograms. Just another issue she's pointing out of lack of access to some of these places. Just how do we tackle that problem? Where are we heading with that? Making sure that people have the best access to a cancer that you said off the top so very rare, or so very common. So what do we do?
I think the best way for us to tackle this as a nation is we've made baby steps. We are now requiring breast density notification. I am hoping this will help gain some power for policymakers to push forward the Find It Early Act. And I think once there is coverage by insurance for these exams, that will give hopefully more facilities leverage to invest in technology to offer these studies. These are not cheap pieces of equipment.
Right.
They require a lot of experts to maintain and manage and read these studies. And I think as we have more support and insurance payment, I think people will hopefully start offering more of these exams. KU is rare in that we offer many of these and hopes to improve access for our patients, but that's quite rare now.
And let's not forget our group of ladies who travel a couple hours. They do it every year to come over and make a trip out of it. So it's worth it to get in the car and drive that way. Question, you answered it already, but I do want to reiterate this. Jeremy wants to know, do dense breasts also raise cancer risk, or is it just because it's harder to find? Just repeat that so people understand that it's both.
It's both. It's both. And breast cancer risk is increased because breast cancer arises from that white tissue in the breast, that fibrous tissue or that fibroglandular tissue. So patients who have dense breasts have more of that tissue that can make cancer. So their breasts essentially have more opportunities for breast cancer to arise or develop than patients without dense breast tissue.
It just over time, since you've been doing this, are you noticing an uptick and a trend of more and more women just putting that date on the calendar, holding it sacred, coming in and doing it, encouraging their friends, or is there still resistance?
I actually am seeing more and more patients not just get their mammogram screenings, but their supplemental screening. We have a very strong patient population strong population of women that really advocate for supplemental screening. This is one of the reasons we have invested our time and money at KU into providing all of these different options for our patients, because we want to meet the personal needs of all of our patients and make sure that we have something available for women, because there's not a lot available in our state right now. So we want to be the place that women feel they can come and get the best breast cancer screening available. And I hope that improves over time in other locations as well.
Always, always. Katie, what's it like? With your group of friends and the women that you know out in the community, is there still a pushback, or some people just not wanting to know, some people not wanting to do it? They're just, I know women still to this day who are in their 60s, 70s and have never gotten one. So what are you hearing out there?
Well, I mean, I feel like generally the people in my I'm 43. I feel like most of my peers are pretty good about getting their mammograms and their screenings that they are supposed to get. And I will say that KU makes it really easy. They send the reminders, and it's a really quick process. It's not like it takes forever to get it done. So, I mean, it's never very fun, but it's you just do it. I mean, I feel like most people that I know, would want to know if they have breast cancer, it seems to me. So I feel like they are pretty good about being like, okay, if I need it, I'll get it.
Yeah, I think it's the messaging is changing. And yeah, I do love those big flashing red warnings that you are overdue for your mammogram that come across. They do not they don't let you slide very easily. I want to get our takeaways today. Dr. Winblad, I'll start with you. What's the big takeaway? We talk about dense breasts a lot, but very specifically, what do you want people to know?
Well, we're talking about dense breasts. So I recommend, if you've had a mammogram, look at your result letter, look at your report. If your report says you have dense breast tissue, talk to your healthcare provider or your mammogram facility. See what options you have available for you to have additional screening.
Yeah, don't be fearful. Just ask more questions,
Absolutely.
like Katie did. Thank you for coming on and just sharing your experience.
Absolutely.
Just what do you want the takeaway to be for women who are listening and wondering? What do you want them to know?
I mean, I would just say be proactive and don't be afraid to do it, because it's probably going to be a lot less trouble if you do it early than later.
Correct. So
great. Thank you for leading by example. Both of you, appreciate you always. A special episode of the Morning Medical Update airs tomorrow on television. Here's a preview.
Her little life is counting on them to do everything that she needs, and people show up and they care and love for her beyond any expectation I could ever have.
Tune in for Cancer, Choices, Hope, and Science. That's tomorrow at 9:30 a.m. on KCTV5 or 9 a.m. on WIBW in Topeka. Again, thanks to all of our viewers for being with us today, and of course our guests. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update, meet a first grader living with his mom's kidney inside him. I'm Jessica Lovell on the next Morning Medical Update. We check up on little Brennan, born with prune belly syndrome, and see how life has changed with his new life-saving organ. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.